It's something we do every single day, probably without even thinking about it. But what if I told you most of us are getting it completely wrong? Let's dive into some secrets about brushing your teeth that a dentist with 20 years in the game knows.
Okay, wait. The idea that you prevent cavities by brushing your teeth is wrong? Whoa. I know, that sounds completely backwards, right? It goes against everything our parents, our dentists, everyone has ever told us. But stick with me, because understanding this one wild idea is the key to, well, unlocking a lifetime of better dental health.
So, then what have we all been doing all this time? Exactly. If brushing isn't about stopping cavities, then what is it for? It's time to kind of unlearn some of those old habits and get down to the real science of what's happening in our mouths. So, our first step here is to totally redefine the goal. We've got to stop focusing on the stuff we can see in the mirror and start thinking about the enemy we can't see. You know the drill. We look in the mirror, don't see any leftover food, and think, yep, job done. But here's the thing. Brushing isn't really about getting that little piece of spinach out from between your teeth. Its real purpose is to mess up, to disrupt this invisible film of bacteria that's always forming on your teeth. And that film, that's plaque. Here's a great way to think about it. Imagine a greasy frying pan. You wouldn't just run it under some water and call it clean, would you? No way! You have to actually get in there and scrub off that sticky, invisible, greasy film. That is exactly what you need to be doing to the plaque on your teeth.
Okay, so brushing is for plaque and keeping our gums healthy. Got it. But then, what about cavities? This is where things get super interesting.
Get this. This is a fact straight out of dental textbooks. A single bristle on your toothbrush is physically too big, too fat, to get into the tiny little grooves on your molars. The exact place where most cavities form. So it doesn't matter how hard you scrub, you're literally not getting in there. And that's why even people who are super diligent about brushing can still end up with cavities. So how do you actually prevent those cavities? Well, it really comes down to two things. First, dentists can literally seal off those deep grooves with something called a sealant. This is fantastic for kids, by the way. And second, for all of us, it's about using fluoride. Fluoride makes our tooth enamel way stronger and much more resistant to decay.
All right, so we've covered the why. Now let's get into the what, the actual tools. Because to do this job right, you need the right equipment. And you might be surprised to hear this, but most of the stuff you see on the store shelves, it's designed to sell, not necessarily to clean effectively.
So forget all those flashy toothbrushes with the weird rubber grips and spiky bristles going in every direction. A truly great toothbrush is actually really simple. Here's what you want. A ton of bristles, and they should be flat cut to get the most contact on the tooth. You want a small head so you can actually reach those teeth way in the back. And a simple handle, almost like a pencil, that encourages you to hold it gently instead of gripping it like you're about to scrub the floor. Now for toothpaste. It's even simpler. You really only need to care about two things. First, how much fluoride is in it. That's measured in ppm, or parts per million. And second, you want to check if it has a foaming agent called SLS. And here's the magic number you're looking for, 1450 ppm. That's pretty much the highest concentration of fluoride you can get over the counter, and it gives you the best protection, especially if you tend to get cavities or have sensitive teeth. Honestly, anything under 950 ppm is just not going to be effective enough. We've all been trained to think that more foam means it's cleaning better, but that foaming agent, sodium lauryl sulfate, SLS for short, is actually working against you. For one, it's a harsh detergent that can cause canker sores and dry mouth for some people. Second, all that foam actually makes your teeth slippery, so the bristles can't get a good grip on the plaque. And get this, it's the real reason orange juice tastes so disgusting after you brush your teeth. Okay, you've got the right tools. Now for the most important part, the technique. It's time to forget everything you thought you knew about scrubbing your teeth. There's a really simple method to remember this. S is for soft. You want to hold the brush super gently, like a pencil, absolutely no death grips. Next, O is for open. Open your mouth and actually watch what you're doing in a mirror. Don't just brush by feel. The second O is for one by one. This is key. Clean each tooth individually. And finally, D is for deep. You need to aim the bristles right at the gum line, where the plaque loves to hide, not just the middle of the tooth. I love this analogy. Think about a broom. You sweep with a broom, right? You don't scrub the ground with it. Your toothbrush is a broom for your teeth. The bristles are meant to gently sweep that plaque away from the gum line. Pushing harder, that's your enemy. It doesn't help. And hey, this goes for all you electric toothbrush users out there too. The number one mistake people make is pressing down and scrubbing around with it like it's a manual brush. Nope. The right way is to just place it on the tooth, let the brush do the work. Then you lift it and place it on the next tooth. You should be applying basically zero pressure. Okay, so we've covered the why, the what, and the how. But I've saved one last secret for the end, and honestly, this one might be the most counterintuitive thing you'll hear today. It's all about what you do the second you're finished brushing. So after you brush, should you rinse your mouth out with water? I mean, it seems obvious, right? Of course you do. You've got all that toothpaste in there. But what if I told you that by rinsing, you're literally washing all the good stuff right down the drain? Think about it. The whole point of that high fluoride toothpaste we talked about is to get the fluoride onto your teeth. But that fluoride needs time to soak in and do its job of strengthening your enamel. It's a chemical reaction, and it doesn't happen in a split second. So here's the big reveal. When you're done brushing, just spit. Don't rinse. Spit out the extra toothpaste, but don't follow it with a swish of water. That little bit of fluoride you leave behind keeps working for hours, giving you maximum protection. Fun fact, in a lot of European countries, this advice is printed right on the toothpaste tube. Okay, last thing. Let's talk about time. Everyone's heard the 2-minute rule, right? Well, guess what studies show? The average person only brushes for about 45 seconds. 45. And to actually clean every single surface of every tooth, one by one, like we talked about, yeah, that's going to take a lot longer than you think. To do it properly, to give every tooth the attention it needs, we're talking about 10 minutes. Yes, 10 minutes once a day. And I know that sounds like a crazy amount of time. But when you stop and think about what that 10 minutes is for, it really changes your perspective. And that's really what it all boils down to, isn't it? Is 10 minutes a day worth a lifetime without expensive, painful implants? Because this isn't just about dodging a filling here or there. This is about keeping your own teeth in your head for your entire life. When you look at it like that, 10 minutes a day suddenly seems like one of the smartest investments you could ever make in yourself.